Okay, so it's very important that you see us on a yearly basis, or at least every 2 years. That will definitely reduce your risk of cancer. And as I showed you earlier, most of these cancers happen in women in their 50s and 60s, which is way after you've had your baby. So these symptoms, okay, can be confused with other medical problems, such as minor digestive disorders. Everyone always feels, oh, I ate something, I don't feel well, I feel bloated. But bloating or increasing in abdominal size, that's a big warning sign. I can't tell you how many patients I've seen that we diagnosed with ovarian cancer that told me, I just thought I was getting fat. My husband told me to go on a better diet. It wasn't a diet. She had a huge tumor in her belly and had fluid in her abdomen, and that was causing the abdomen to get bigger. Okay, if you're having pelvic or abdominal pain, if you're suddenly feeling that you're having difficulty eating or that you feel full when you didn't feel that way before, those are all warning signs. And you need to let your GYN know. And us GYNs, we're busy, we see a lot of patients. Some GYNs don't have the time to ask these questions. Okay, so it's important that you tell them, I don't feel well, I feel bloated, something is wrong, okay? And if you do say that to your GYN, they will send you for extra tests that hopefully will diagnose your ovarian cancer. If you have, most of the time when you have these symptoms, you won't have ovarian cancer. So I don't want to scare you. It's rare that these symptoms, because they're so common, these symptoms will actually result in an ovarian cancer. But you need to be aware. The other thing I mentioned earlier is, unfortunately, there's no good screening test for ovarian cancer. Okay, but if you have the symptoms, you'll usually have a physical exam, including a pelvic exam. You'll have imaging studies of your ovaries, which usually is a sonogram done through the vagina and through the abdomen. And you may have some blood tests done, the most common one being CA125, which is a tumor marker. Okay, one word about CA125. I have a lot of women that hear this test and say, I want this test done. This test is a very inexact test. Okay, it is very oftentimes abnormal in the absence of cancer. Okay, so we don't recommend it for the general population, because if you do it for the general population, many women will have unnecessary surgery, which in and of itself is dangerous. So we only do it for women who have symptoms, for women who have abnormal sonograms. Okay? The only way to tell for certain if a woman has cancer of the ovary is to biopsy the ovary. Since the ovary is inside the abdomen, that will require some sort of surgery. Next slide. So that's ovarian cancer. Okay. Last but not least, cervical cancer. Okay, cervical cancer really is a success story. Okay, like I said earlier, cervical cancer was very common before the advent of the pap smear, which in the United States, most women have it. I would say 70 to 80% of all women have regular pap smears, which is terrific. Nonetheless, there still are women that develop cervical cancer, about 12,000 new cases of cervical cancer a year, and about 4,000 women will die from this disease. Okay, and it really is largely preventable if you're having a regular pap smear. Okay, about 1/2 of cervical cancer cases occur in women who have never had a pap smear. Okay, and about 70 to 80% of women who have cervical cancer have had inadequate screening. The woman that I told you earlier, she had her last pap smear 10 or 20 years ago with the birth of her last child, and since then didn't have a pap smear anymore. If you have regular pap smears, and you go to the gynecologist on a regular basis, I can almost guarantee that you will not develop cervical cancer. And the good news about cervical cancer is if it's found and treated early, more than 90% of women who have it will be cured. As with other cancers, the more advanced disease, the lower the cure rate. Next slide. Okay, so what happens? How does cervical cancer develop? It's important for us to understand that, especially when we go on to the human papillomavirus and HPV. If you see any abnormalities, then you must go back to your gynecologist, and then we do a procedure called a colposcopy, which is a big magnifying glass with a light, and we look at your cervix, and then take biopsies of the cervix. a little bit more uncomfortable than a pap smear, but easily doable. Most women think it's a pretty easy procedure. And if your pap smear and colposcopy show abnormality, then you can be treated, and that will prevent the cancer. Next slide. So this is just a schematic of what normal cells look like on the left, and what happens as they become abnormal, and then what happens when cancer develops. And it takes years from when the abnormal cells start to when the cancer happens. Can take up to 10 years. HPV. We've all heard HPV. It's everywhere. It's even candidates for presidency are talking about HPV. Okay. And we know for a long time now that cervical cancer is caused by the human papillomavirus, which is a virus that most women in their lifetime and men will be infected with. There are many types of HPV strains, okay? And some of these strains are called the high-risk types. These high-risk types are the ones that potentially cause cancer, not only of the cervix, but of the anus, the vulva, the vagina, and the penis. Okay, a lot of people are scared about the HPV infection, and as soon as I tell them you have an HPV infection, they go into a deep depression and they don't understand how they got it. It's very important to understand that it is extremely common infection. It's actually more common to have it than not to have it in your lifetime. Okay, and it is passed from person to person through sexual contact, not necessarily intercourse. Even close contact will transmit this virus. And most women and men who become sexually active will get it. And most of the time when you get it when you first become active. Like 3 out of 4 people who have sex will get genital HPV infection during their lifetime. You can reduce your risk of transmission by condom use, but it's not 100%. You can still get it with condom use. Next slide. The important thing that you have to understand is even though you have an HPV infection, it doesn't necessarily mean that that person will get a genital wart or develop cancer. As a matter of fact, the majority of people who have HPV infection don't know they have an HPV infection and will never get a wart or a cancer. What happens is that the HPV enters the cells, and that's what causes those cellular changes and the abnormal growth of the cells. The good news is usually our immune system will get rid of this virus in a similar fashion that our immune system gets rid of other viruses, like the common cold, like the chicken pox, like most of the viruses, okay? So usually our immune system will get rid of it and the infection will go away on its own. And the earlier you get the infection, the more likely you are that your immune system will get rid of it. Because a young person's immune system is better than an older person's immune system. Unfortunately, a small number of women, HPV will not go away. Their immune system is not capable of getting rid of it. Sometimes it's because there's a problem with that person's immune system. If someone's taking any medications that modifies their immune system, there are many diseases for which patients get medicines to lower their immune system. Or if someone has a disease that lowers their immune system, the most common one being HIV, that will increase their chance of this infection being persistent. And for those women who have persistent infection, they're the ones who are at increased risk of developing cancer. And the longer the HPV is present, the more likely you are to develop cancer. Next slide. So the best way to actually prevent cancer nowadays, cervical cancer, is to prevent the HPV transmission. And luckily, I think it's now about 5 years. We have the first vaccine came about 5 years, maybe the second vaccine came about 3 years ago. We do have 2 vaccines that are available that protect against some strains of HPV, not all of them. But if you do get the vaccine, studies have shown that it will reduce your risk of developing dysplasia, the precancer, by up to 75%, and probably cancer by that much too. So it is very good. 75% reduction is huge. And it is a very safe vaccine. It's recommended that any woman under the age of 26 is a good candidate for it. Probably in the next couple of years, it will go to women of older age. it's always best to give it to younger women, especially if they've never had sex before, because it's not meant to treat HPV, it's meant to prevent it. The way that the vaccine works is it triggers the immune system to fight the HPV once a person acquires that infection. Okay? There's also an HPV test that's now available. It's been available for a while. And an HPV test can be used as an adjunct to a pap smear, and the pickup rate for abnormalities is slightly higher. And so the HPV test can be used in women over the age of 30 as an adjunct to a pap smear, and that will increase your detection rate. And the good news is that if you do a pap and an HPV test, let's say you're 35, you did a pap and an HPV test and that's normal, you don't have to go back to your GYN in another year. You can go back in 2 years or 3 years for a pap smear. There are other issues and you do need to see a GYN earlier than that. Okay? And the HPV test can detect many of the high-risk types of HPV even before they're visible on a pap smear. Next slide. Okay, next slide, there we go. What are some risk factors for cervical cancer? If you've had multiple sexual partners, or if you had a male sexual partner who had multiple sexual partners, that increases your chance. Everyone asks me, well, what does that mean, multiple sexual partners? And I usually say more than one. More than one is vulnerable. Okay? If you had an early age at which you had first sex, that increases your chance. If you had a history of previous abnormal pap smears, previous dysplasias in the past, that increases your chance. So if there's someone in the audience that was once treated for an abnormal pap smear, okay, and their doctor said, okay, you're fine for now. In the future, your risk is higher. So those people are more important that you see your gynecologist every year. If you had a family history of cervical cancer, if you smoke, smoking increases your chance of cervical cancer tenfold. Women who I see who have dysplasia, who want the HPV infection to go away and ask me, what can I do to make sure I don't develop cancer? Really, the only thing that you can do once you have the HPV infection is stop smoking if you smoke. Okay? If you've had an STD in the past, like chlamydia, that increases your chance. And we mentioned this earlier, immune deficiencies increase your chance. Okay, symptoms. Okay, cervical, when you have the precancer, the dysplasia, that usually is asymptomatic. And that's why you need to have pap smears, because you won't know otherwise that you have a precancerous condition. Okay, now if you haven't done your pap smears and many years have passed and you had dysplasia and you didn't know about it, and now you have cancer, well, that can have some symptoms. And the usual symptoms, like many other gynecological symptoms, is abnormal bleeding. Okay, your periods are not what they used to be, especially after intercourse, having what we call postcoital bleeding, bleeding after sex. That's always a bad sign. How do we make a diagnosis? We do a cervical biopsy. We go to the gynecologist. It's very simple to do a cervical biopsy. And as I mentioned earlier, as long as a woman follows her doctor's recommendation and has pap smears with or without HPV test, you will significantly reduce your risk of developing cervical cancer. And as I mentioned again earlier, since the advent of pap smear screening, pap smears have been able to reduce cervical cancer by over 80%. Probably the best cancer screening tool that we have to date. If you compare all the screening tools, pap smears are the best. And that's why I think that there's the highest, don't quote me on this, but I think we have the highest compliance rate with pap smears. But still, it's not 100%, and that's where we want to be. Next slide. And just for everyone to know, these are the current screening guidelines by the American Cancer Society, so that you all see it yourself. Okay, it should begin approximately 3 years after a woman's having intercourse, but no later than 21. Okay, so if your daughter started having sex and she's 18 years old, you don't have to rush her immediately to the gynecologist for a pap smear. You do, however, need to rush her to the gynecologist for STD screening, for birth control, for any other type of issue. Okay, and screening should be done every year or every 2 years. Okay, at or after age 30, women who had 3 normal tests may be screened 2 to 3 years. Okay, and you can have an HPV test It's the HPV test, the human papillomavirus DNA test. Okay, and some things that people don't know is if you're 70 and older and have had 3 or more consecutive pap smears that have been normal, you're off the hook. You don't have to come in. Okay, for a pap smear. You do need to see your gynecologist for regular gynecological health, but you may not need a pap smear. So if your gynecologist tells you you don't need a pap smear, don't get upset. You probably don't. Okay? Or if you've had a hysterectomy, which means removal of the uterus, and removal of the entire uterus includes the cervix, and you had it done for benign reasons, then you don't have a cervix anymore. You don't need to have a pap smear because your cervix is taken out. That's it. I think that's my last slide, yes.